A dental implant is hands down the best option available for anybody when they're missing or they're going to miss a tooth. The first step for placing an implant is that, of course, we need to make 100% sure that you're a candidate for it and that we have enough healthy and enough bone available so we can screw that implant in place. That's why we use 3D scans, CT scans, and all this technology so we're sure that you're a good candidate for it. If you are a good candidate for it, then that's when all the other technology comes in. We place the implant in your jawbone. It takes approximately like half an hour to do it here in the office. We do a lot of planning on the computer before we get to you. Patients don't have any real downtime afterwards. We can use implants for a lot of different applications. If you need a bridge on top of the implant, if you're missing 2 or 3 or even 4 teeth, we can use implants for that and give you something permanent on top of them. If you have dentures and they're painful and whatnot and they move, we can put 2 or whatever amount of implant in there and we can hold those dentures from there. They have this bulky plastic in the roof of their mouth that they cannot taste their food on or their gag on, or their lower denture just moves around so much that it's painful and really uncomfortable. With dentures, what we can do is that instead of having those dentures just moving around on the patient's mouth, we can put implants in there and then have those dentures snap into those implants. So when the patients are wearing them, they're not moving anymore. Patients can now eat and laugh, and they can not be worried that you're just gonna fall out when they're speaking to somebody.